So you're having 8 plants, 5 in India, 3 overseas, with turnover of exports of over 500 crores, directly employing hundreds of people, indirectly employing thousands of people, impacting the lives of lakhs of patients and making crores of rupees. All this was actually new to me, but very, very pleasant. I'm really pleased to hear all this. I congratulate each one of you, the 3 brothers who started this movement. You have fought and won a battle in your mind. Half the job is done, because the fighting the battle in the real world then becomes an easy. Most of the people who lose actually don't lose in the physical world, they lose in the mind. If you've lost the battle in the mind, there is no point fighting in the real world. It's as good as lost. So it was fever, which was the commonest symptom. But this year, very, very atypical symptoms. So a lot of people actually started with sore throat. Mr. Himanshu said that he suffered. Even I suffered from COVID, although I got vaccination at the first opportunity, and I had received both the dosages of Covishield in January and February, because at that time 4 weeks was the time gap recommended. But besides that, in the April 1st week, I got it. My wife, who's an hospital administrator in Gangaram, she also had been vaccinated, but from me, she got it, and our daughter also got it. But since we were post-vaccine, so it was a mild disease. But I also started with sore throat and flu-like symptoms, and fever actually came 4 days later. Diarrhea, nausea, vomiting, dry cough, headache, and pain in other areas were also symptoms many times. And that is the reason many times many people did not even suspect that it is COVID. They did not get tested. They continue to roam in the society. And that is one of the reasons why this disease spread much faster. So this was one reason. Highly infective nature of the virus was the second reason. And third reason, of course, we all know how during January, February, political, religious, and other activities allowed huge crowds to assemble, which were the super duper spreaders of this disease. And all of these together led to the mayhem that we saw. So although now we are past this, our numbers are now coming down, but just as we are all worried about third wave, so I thought, in case if the third wave comes, the message would be, the moment you have any of the suspicious symptoms, the first thing that a person should do is to isolate himself. It is better to do over in the area of isolation than to do under, because if you do under, you are actually becoming a super spreader. If you overdo it and isolate yourself, you are actually preventing the infection from spreading. A COVID RT-PCR is negative in about 30% of the cases. So antigen test is having only 50% sensitivity, but 100% specificity. So there is no false positive in antigen test. So if you do a rapid antigen test and it is positive, there is no need to confirm it by RT-PCR. If it's negative, you could still be positive, and therefore there is a need to confirm it by RT-PCR. If RT-PCR is positive, it is positive. There is never a false positive. There is no need to second time confirm it. But if it's negative, you may actually give precedence to symptoms and treat yourself as COVID rather than believing the RT-PCR, because RT-PCR may be negative in about 30% of the cases. This is important. Rapid antigen test, only 50% positivity, but no false positive. Positive is positive. Negative may still be positive. RT-PCR also, no false positivity. Positive is positive, but negative may still be positive. And when there is a clash between antigen test, RT-PCR, and symptoms, we give precedence to symptoms and recommend treatment, isolation and further treatment. Majority, even this time, were mild symptoms who only needed home isolation and treatment. But home isolation and home treatment does not mean self-treatment. It is treatment under the care of a doctor. Now, there were a lot of people who were writing a lot of prescriptions. So when this was starting, I thought that there is so much of confusion. So I one day sat down with a friend of mine and we just put these various M's together and gave out this first video about 6 M or 6 mantras of home management, which consisted of No mixing. That was mantra number 1. The moment you have a suspicious symptom, go in isolation. Number 2, what medicines to take. Number 3, how to monitor yourself at home because you are not being seen there by a doctor. Pay attention to meals, pay attention to mindset, and beware of the point where you have to move to the hospital. Temperature, saturation, water loss, and some other things were the ones which we recommended. And of course, we always said that anytime if your saturation goes below 90, if your temperature is not settling beyond 5 to 7 days, and especially if it continues to be persistently high, if you ever develop breathlessness, altered sensorium, very high 140 plus, or very low below 50 heart rate, or you have excessive diarrhea leading to dehydration. So excessive diarrhea, very high or very low heart rate, altered sensorium, breathlessness, excessive cough, temperature persistently very high, especially beyond 7 days, and ever saturation going below 90. These are red flag signs, which means you should move to the hospital. Everybody has been talking of third wave. Third wave, people are saying how to prepare for third wave. Now, I have a little objection to that. And I keep saying, instead of saying how to prepare for third wave, let's first say how to prevent third wave. So instead of prepare, I would say P and P. So first P is prevent, and of course, side by side, prepare also. How to prevent third wave, and if it still comes, how to prepare for it. Because if it comes and if it's like the second wave, then no matter what preparation you do, things will go haywire. So let's see what are the 2 important pillars which we need to focus on for preventing the third wave. First is about vaccine. You know, friends, there is a lot of negative talk around vaccine, this, that, and other. As someone who's been in the front line and who has actually been part of the entire process of development, phase 1, phase 2, phase 3 trials, the real field trials, phase 4, and everything, there are few very clear-cut messages. Number 1, as of today, vaccines are our most effective, most valuable method of addressing corona issue. There may be talk about Delta variant, whether it is sensitive to this or not, all that can continue. But as of today, vaccine is the most effective method, and it is the duty of each one of us to not only take it ourselves for our family, but also do everything possible in the society to have maximum number of people take it. There's a lot of talk about which vaccine to take. Well, as per the data, the RNA vaccines, which is Moderna and Pfizer, are supposed to have about 94-95% efficacy, which means if 100 people take those vaccines and they're all exposed to the infection, 94 to 95 will not have infection, only 5 to 6 will have. With Covishield, it is supposed to be about 70%, Covaxin around 76 to 78%. So with Sputnik, it is reported to be 92%, but we are yet to test it on the ground. Those are Russian data which has been made available to us. Whatever it is, even if our vaccines are 70 to 80%, it is a huge advantage. And there are many people I know in my circle who have not yet taken Covishield or Covaxin, waiting कि नहीं साहब हम तो वो Moderna और Pfizer जब आएगा ना वो लगवाएंगे, हमें तो 95% वाली चाहिए, हमें ये 70-80 नहीं चाहिए. I don't think there can be anything more stupid than this for the today. Covishield, Covaxin, and Sputnik are available. Whichever is available. A lot of people ask me, sir, ye better hai, wo better. Trust me, when I went to my hospital vaccine room to get the vaccine, I did not even ask them which one we have got. I just went, got my shot. When I was exiting from that room, I asked the sister, ye aapne kaun sa wala lagaya? Just for my knowledge sake. She said, sir, ye Covishield. I said, fine. My wife was in a different hospital. Wahan par Covaxin aayi. She also went and got it. And we said in the evening, acha mujhe Covishield lagi, aapko. Both are good. Both are effective. Both are safe. Both are efficacious. Indications. Now, everybody should be taking the vaccine. The only contraindication as of today is children under the age of 18 years. There was a time where lactating mothers were out, government has included them. There was a time where pregnant women were out, the government has included them in now. As of today, children under 18 is the only group which is out. Now, a lot of people ask me, what are the contraindications? Truly speaking, friends, there is no contraindication. Lot of diseases are mentioned: diabetes, hypertension, heart disease, tuberculosis, asthma, abdominal diseases, liver diseases, kidney diseases, brain diseases, cancers, history of operations in the past, joint diseases, soft tissue diseases, people who are on anti-tubercular therapy, people on blood thinners, people on steroids, people on this, people undergone organ transplantation. Friends, the answer to all these questions is just one: you can take it. Truly, there is no contraindication. If you're a diabetic, you are a hypertensive, you are a heart disease patient, you are on blood thinners, anything, take the vaccine. You've got lung operation, abdominal operation, breast cancer operation, neurosurgery operation, you have soft tissue diseases. Answer is, please take it. There is no contraindication. If you have many diseases, then trust me, your chances of getting corona and your chances of dying from corona are much higher than those who do not have the diseases, and therefore the protection that you get from vaccine is far more helpful for you than for somebody else. Yes, second thing which we need to do very, very religiously to prevent third wave is what is called COVID appropriate behavior. And there are 4 pillars of that. Number 1, mask. As of today, unlike last year, where we were talking about hand hygiene, and that's how my involvement started with that video, today we know it spreads by aerosol. So when I'm speaking, the aerosol which is coming out of my mouth has, if I'm infected, will have trillions of viruses, and they go for few meters and they stay in the environment for many hours. If I'm wearing an N95, this is ordinary mask, but if I'm wearing an N95 like this prevents 95% of aerosol from coming out. So if I'm not wearing a mask, 100 is coming out. If I wear an N95 mask properly, and properly means your nose clip has to be applied properly, it has to cover completely from the side, and it has to come under the chin. If you wear N95 properly and you are not breathing from the side, everything is through the mask, 95% aerosol is split. So instead of 100, only 5 number of virus comes out into the environment. And suppose Mr. Bag is sitting a meter or 2 meters away from me. 2 of us are in the same room. I'm infected, he's not. I was not wearing mask. I released 100 units for him to inhale. He's also not wearing mask. He inhales all the 100 units. So this is one scenario. Both are not wearing mask. Now, another scenario, I'm wearing mask. I release only 5. He's not wearing mask. He inhales 5. Third scenario, I'm wearing N95. So I release only 5. He is also wearing N95. Now he protects 95% of those 5 from going inside his nasal cavity or chest cavity. So 95% of that 5 is prevented, and only 5 of the original. That means 0.25% of what I would have released actually goes to his respiratory tract. So what happens? Your dose exposure goes very, very, very low, and therefore your chances become less. So this is how mask is important. N95, ideally, if N95 not there, you can wear a combination of this surgical mask fitting properly and a double layer cloth mask over that, both fitting properly. Fitting properly is important. Nose, mouth, chin and side, it should all be covered. That's number 1. Very important first pillar: mask, mask, mask. Don't move out of your mask with a house without a mask. 2, physical distancing. We know that while speaking, the aerosol goes for a few meters. So if Mr. Bed is very close to me, he will have more dose exposure than if he's sitting away from me. So that's the importance of physical distancing. And number three, mass gatherings. Now it's known that this accumulates in the air, it remains in the air for few hours. So suppose I have this office, it's closed, it's an air conditioned office, all windows, doors, everything is closed, and that air conditioner is a room air conditioner, it's recirculating the air. Everything that I'm releasing into the atmosphere is actually remaining in the atmosphere and getting recycled. Anyone coming from outside to my room is immediately exposed to that huge dose, and he or she inhales and he gets infected. Another situation, I open all the doors and windows and I put a exhaust near one of the windows, very high speed exhaust, which is continuously throwing the air from my room outside and getting fresh air. Now I'm releasing continuously, but faster than I'm releasing, that exhaust is throwing that air out, and there is continuous fresh air coming into the room. Now somebody Charu walks into my room. Now she is exposed to much, much less than she would have been if I was not having this exhaust. So therefore, mass gatherings were one of the reasons for the fast spread last year, where people had birthday parties, whether marriage parties in banquet halls, closed, air conditioned, many hundred people in one hall, everybody got infected. So please avoid meetings, avoid mass gatherings. If you have to, keep all windows and doors and everything open, have exhaust at the windows, and allow cross ventilation. The key word that I want you to remember, cross ventilation. If there is a continuous circulating air, the infection dose will be less and chances will be less. So this mask, distancing, and avoiding mass gathering, all the three, what they are doing is to reduce the dose exposure to the person and thereby decreasing the chances. And trust me, these are very, very effective methods, and these need to be practiced even after you have got vaccinated. Now, vaccination does not mean कि आप हनुमान जी बन गए और अब आपको कोई चीज टच नहीं कर सकती. No, we know that 30-40% people can have disease despite being vaccinated. So vaccination is vital, but even after vaccination, continuing COVID appropriate behavior is also equally important. So friends, if you ask me, what do you do to prepare or to prevent third wave? I would say just two things. Get everybody vaccinated and let everybody behave in a corona appropriate way. If the country can go crazy about vaccination and crazy about COVID appropriate behavior, friends, definitely I promise to you, we would have prevented the third wave. Of course, last is soap or sanitizer, but we know it's much less important than the huge importance that has been given. All these sanitizers lying all over, they are much less important than the first three things which I have. So I call it MSMS: mask, social distancing, mass gathering, and soap. And now I come to the last part, and that is post-COVID management. So when we saw the patients last year, we noticed that many patients after recovering were continuing to have some symptom or the other, but somehow it was sort of managed. But this year, in the second wave, we realized that anybody and everybody who got corona, including me, myself, after recovering, there was some problem or the other which was persisting, and that was given the term post-corona syndrome or long COVID or prolonged COVID or chronic COVID. Various names have been used. Basically, these are situations where despite recovery from COVID, you continue to have some problems and they continue to trouble you. Now, what are those and how to address is something I would discuss in next 5 to 7 minutes. So the fact is that 98%, if you look at the mortality reported is about 1.4 to 1.5% nationwide. In Delhi, the reported mortality in the second wave was about 2.5%. So Delhi reported higher mortality than the rest of the country figure. And what are the mental issues also I have discussed. But why are these mental issues there? Answers are very obvious. You've been to the hospital, in the ICU, in the ward. Unlike all other diseases where relatives used to be part of us in the hospital, except ICU, this time in Corona, everybody had to be alone. That's number one. Number two, normally the nurses, the doctors, the other people would like to come to you, talk to you, and assist you. This time, every time they were approaching you, they knew that they are going towards a corona bomb, and the longer time they spend with you, more is their exposure, and they would reach you, do the minimum and just run away from there. So you had minimum human exposure during this period of your maximum stress. You were hearing all the time, iski death ho gayi, uski death ho gayi, isko ye ho gaya. And in this time mein, instead of somebody being there to give you succor, to give you help, you were all alone. Now this was a very, very stressful time. On top of that, there are huge financial issues. You know, I mean, all of you would know this better than I know, what it is doing to our finances. There is so much of uncertainty about future. क्या होगा, कब तक रहेगा, कब रिकवरी होगी, कोरोना से रिकवरी कैसे होगी, इकोनॉमिक रिकवरी कब होगी, will we ever go back to those olden times? This is the question asked to me every day. Doctor साहब, क्या वो पुराना समय कभी वापस आएगा? Nobody has the answer कि वो वापस आएगा कि नहीं. And on top of all that, we have pandemic of misinformation on the TV and on social media. So all these issues put together increase your step. How do you approach it? Friends, these are some 3, 4, 5 slides. ये आपको बहुत सिंपल लगेंगे, आप कहोगे अरे ये क्या डॉक्टर साहब, बट ट्रस्ट मी, these are made after talking to a lot of psychiatrists, psychologists and patients, and have been practiced on hundreds of patients. They have benefited and they have given me feedback. Yes sir, हमने जिस दिन से इसको religiously follow किया, हमारे symptoms कम होने शुरू हो गए. So I would share this with an appeal to trust in it, to believe in it, believe in the power of these slides and practice, and they will help. Or you can share with those who need this help. So first thing is, when you are in the hospital, your schedule gets haywire. ICU में ना दिन होता है ना रात होती है. It's all beep 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 all the time. Your sleep goes for a 6. Your normal schedule goes for a 6. When you come back home, that continues. So first thing you need to do is to structure your 24 hours. Fix a time for sleeping. Fix a time for waking up. 10:30 is a good time to go to bed. Even if नींद नहीं आ रही है, आप एक book ले लो. I find that reading is the best hypnotic. मैं जैसी किताब पढ़ के लेटता हूँ, वो 2 मिनट में नींद आ जाती है. किताब छाती पे पड़ी होती है. So try that and fix up a time. 5, 5:30, 6 is a good time to wake up. After waking up, after doing with your morning course, you should do some exercise, which should be a very mild to begin with. आप घर में कुछ भी करें, अपने लॉन में वॉक कर लें, ट्रेडमिल कर लें, क्रॉस ट्रेनर कर लें, स्टैटिक साइकिलिंग कर लें, but anything, but start with very mild few minutes, and gradually as you improve, go on increasing it. Then you have your breakfast, but after that do some meditation and relaxation exercise. There are a whole lot of them available on the internet. I won't go into detail, but do spend some time doing meditation or relaxation. This will bring you to about 9 o'clock. After that, I request you to do what I did when I had the tragedy with my friend. Meaningful engagement or positive addiction. We all have a lot of addictions, but many of them are negative addictions. What I mean by positive addiction or meaningful engagement is, a lot of people are working from home, many people are jobless. So we have a lot of free time during which we keep looking at WhatsApp, we keep watching TV, we keep talking to people, and everybody gives us negative news. यार आज उसके brother की death हो गई, आज इसका ये हो गया, आज उसका वो हो गया. Keep yourself away from all this. Find out what gives you happiness. By what can you do something which is meaningful for others, as well as giving some sense of achievement and sense of satisfaction to you. Now, this is what I mean by positive addiction. So I converted my grief into positive addiction of making videos. And trust me, each of these videos actually took several days of planning, recording, re-recording, editing, and then all that. But I said, no, this has to be done. It became an addiction. and it helped me come out of that grief, and it helped others as well. And trust me, meaningful engagement throughout the day, keeping yourself busy with something which is helping others, which is helping you as well, and most important than helping, giving you happiness, making you feel happy at the end of the day, is one of the best ways to relieve your stress and feel happy. We are talking about physical distancing or social distancing, but there is nothing to prevent us from being socially connected on WhatsApp, on Zoom calls, on whether other calls. So stay connected with your friends, your families, share your problems with them. There's a beautiful saying that problem shared is problem halved. So if you have an apprehension, if you have a fear, if you have some panic kind of situation in your mind, don't keep it to yourself. Share it with your friends, with your family, with other people. Who knows, somebody will come up with a solution, with some suggestion which will reduce the stress, and that, trust me, will help you a huge lot in reducing your stress. So keep connected with people. Keep sharing your people with others. Who knows, suddenly someday some solution will come, and that will reduce your stress. Do not spend time watching TV and reading those notes on WhatsApp, because they're not checked by anybody. आज मैं रॉकेट के बारे में कुछ चाहूं तो एक वीडियो बना के डाल सकता हूं कि कैसे रॉकेट को बना के स्पेस में भेजा जाए. Nobody is there to check it. So there is so much of unchecked information. Just keep yourself away from all that and just listen to correct people. And friends, most important is next 5 things I'm going to do. The first is positive thinking. The second is positive thinking. Third is positive thinking. Fourth is positive thinking, and fifth is positive thinking. Now you will be thinking ये तो हमको सबको पता है, हमारी कंपनी के ज्यादा positive thinking किसको आती है. Again, friends, knowing is knowing and doing is doing. Trust me, the way you think is the way you feel, and the way you feel, friends, is the way you act. So positive thinking is key to your doing positive acts, and positive acts is the key to your recovering from this corona. So please, instead of negative thoughts, मेरी कंपनी बंद होने वाली है, मेरा ये हो रहा है, मेरा जॉब चला गया, trust me, एक sentence याद रखिए, this too shall pass. It's not a permanent, and you are not alone. It's the whole world is going through. Only the tough ones will survive. The other ones will actually fall on the way. So let yourself not be in the other category. Be the tough one. Develop a positive thinking. एक चीज याद रखिएगा कि situation is not in your control. The corona did not seek our permission before spreading as a pandemic across the world. But how we respond to this is actually in our control. And by modifying our response, we can actually modify our stress and feel better. Positive thinking will heal you. It will heal your family. It will heal the society, and it will heal the country. And friends, if there is one thing which is needed today badly for the whole country, it is actually positive thinking. So friends, my request to all of you is that whenever there is any negative thought about yourself, about your family, about your financial future, job future, professional future, just throw it out of your mind and tell, no, tomorrow is going to be better. Tomorrow is going to be better. Tomorrow is going to be better. Just keep telling your mind, and trust me, force the mind to believe it. And as I said, once your mind believes it, it will so happen in the physical world also. And friends, this is my last slide. And I am very, very passionate about sharing this slide, is to help others. I have found in my whole of life that whenever you are in trouble, one of the best ways to overcome your stress, your trouble, is to find someone who's more in trouble and extend a helping hand to him. A helping hand you extend to others will be the biggest helping hand you would have ever received. You would see here that there is a stronger hand which is there on the top, and there is a weaker hand which is seeking the help. But ultimately, it is the stronger help which will get benefited by extending a helping hand to the weaker hand than the weaker hand would ever. So wherever find out who's in trouble, just go and extend help to them selflessly. If you do it for a selfish purpose, then it loses its value. But if you do it selflessly, friends, believe me, there cannot be a more potent medicine to overcome your grief and your panic and your stress. It will heal you like magic.
Sir, I think I'll not take much of your time now, sir. आपने बहुत time दिया. और sir, thank you so much once again. We are honored, we are privileged to have you today. And I think a lot of information you gave will help us to solve so many queries we had about COVID, post-COVID recovery, and for future. How do we prepare ourselves for future? And I'll also, sir, commit you that we'll be in touch with you more and more often. What we have heard today is, I think, phenomenal, and I think a lot of questions which I even personally had have got answered. So which I'm being connected to the medical fraternity, but very few people are able to answer such questions. But आपने जो आज जवाब दिए, जो questions आपने जो आज answers किया, I think these are really path breaking for all of us. And sir, whatever you've told us today about, taking of MS, we will ensure that we prevent the future of this virus. We prevent, and prevention is the biggest, today, I think, way to let this virus from spreading in future. Thank you so much, sir. Thank you so much.
आप सबको आपकी 25th ईयर पर बहुत सारी बधाइयां और एक बहुत ही ब्रिलियंट ब्राइट फ्यूचर की खूब सारी शुभकामनाएं.
Thank you so much, sir.
Thank you.